All right. Good afternoon to everyone, and welcome to Public Health's virtual education series, Wazooki Family Conversations. I'm Jamie Decora, Public Health Worker Supervisor, and joined today by Ronelle McKernan, the Public Health Nurse, who will help moderate today's session. The goal of the series is to gather, learn, and share about Ho-Chunk culture, resources, services, and the connection to health. In public health, we focus on prevention, promotion, and the protection of the health and well-being of our communities. Health and well-being are rooted in many aspects of our lives, from our physical body, our mental health, our spirit, the environment we live in, and much more. During these sessions, we will explore topics that can impact our health and well-being. Together, we will learn about tools and resources to improve our health and the health of our communities. Today, we are celebrating National Native AIDS, HIV, and Awareness Day. We have with us Joella from Vivint Health here to talk about AIDS and HIV awareness. We will have about 45 minutes for the presentation, followed by a short Q&A. Please use the chat function to enter any comments or questions for our presenters, and Renelle and I will monitor them throughout the presentation. You can also come off of mute and ask any questions or have any comments during the Q&A. Everyone, please welcome Joella.
Hello, everyone. Can everyone still hear me okay? With the exception of the one place that's maybe having trouble. Okay, so I am also new to this format, so please bear with me while I find buttons and things. But I'm going to attempt to share my presentation here. Let's see. We're going to try this one. Are you seeing my screen?
Yes.
All right. I'm glad I'm not the only one having technical challenges today. All right, here we go. So, as mentioned, I am Joella Strebel. I'm from Vivint Health. I live and work on Ho-Chunk land in La Crosse, Wisconsin. I've been with Vivint Health for a little over a year and recently transitioned into the prevention specialist role. And I'm happy to be here today. So thank you for inviting me. This is just a little bit of what I plan to cover in our time together today. So we'll talk a little bit about what National Native HIV/AIDS Awareness Day is and kind of where it started. We'll go over some basic education, some HIV/AIDS 101. We'll talk about PrEP, PEP, and DoxyPEP. We'll talk about what U equals U means, touch a little bit on living with HIV, some of the programs and treatments available, and then get into some specifics around HIV in Indian country. And then we'll close it out with some information about the Vivint Health services available. And I do welcome questions, comments throughout the presentation. So please don't feel like you have to wait till the end. If you have a question that comes up, if you're anything like me, you won't be able to focus until your question's answered. So please feel free to type those in the chat, and the facilitators can interrupt me with any questions that come up. So what is National Native HIV/AIDS Awareness Day? The theme for 2026 is Weaving Our Horizon, Strength, Community, and Equity. This day was initiated in 2007 with the intention to promote awareness and educate Native people about HIV and AIDS. It's an opportunity for Native people and others to create greater awareness of the risks of HIV and AIDS to their communities, to honor those who've passed, and to acknowledge those who are living with HIV or AIDS, to call for increased resources for testing, and to seek support for improving treatment and care options. The day is always held on the first day of spring, and that was an intentional choice to represent a time of equality and balance, new beginnings and birth, and a celebration of life for all people. So this year that will fall this Friday, March 20th. So we'll start with just some information about what is HIV and what is AIDS. If you were around back in the 80s when AIDS was first really kind of blowing up and in the news, we heard a lot about AIDS. We didn't hear a lot about HIV. Now we tend to hear a lot more about HIV and maybe not as much about AIDS. There can be some confusion where people think these are interchangeable terms that are referring to the same process, but they are not. So we'll talk a little bit about the differences. HIV stands for human immunodeficiency virus, and it's a virus that attacks the immune system. What it does is damage our CD4 cells. Those are an integral part of our immune system that helps us fight off basic infections, viruses, and that sort of thing. There is no cure for HIV. However, there is really great treatment available, which hasn't always been the case. Taking medication and remaining on treatment can reduce a person's viral load to an undetectable level. AIDS, on the other hand, stands for acquired immune deficiency syndrome, and that's a set of symptoms that are present in the very last stage of HIV infection. So AIDS is the last stage of HIV infection. It's when HIV advances to AIDS, the amount of HIV in the body increases, and the number of CD4 cells decreases. So it really kind of wreaks havoc on the immune system. HIV medicines can stop HIV infection from advancing to AIDS. Without HIV medications, HIV will typically advance to AIDS in about 10 years. And then ART, or antiretroviral treatment, again, can prevent HIV from spreading and prevent it from advancing to AIDS. So the reason why, back 40 or so years ago, we were hearing a lot about AIDS is because we weren't finding out that people were sick until they advanced to that final stage and they were really, really sick. Now we have a much better understanding of HIV and a much better, much better processes for catching it when people are earlier on in that process. And because of the medications that we have available and the treatments we have available now, many people never advance to AIDS. They live long, healthy, fulfilling lives with HIV without ever advancing to AIDS. Some of the risk factors for contracting HIV include injecting drugs or steroids, and particularly sharing injection equipment, syringes, and other associated equipment. Additionally, unprotected vaginal, anal, or oral sex, particularly like the higher risk behaviors are men having sex with men, having multiple partners, and having anonymous partners. Sex work, which is exchanging sex for drugs or money, can also increase risk. Oftentimes, folks who are doing sex work are with multiple partners and often anonymous partners. And so there's just not as much awareness of people's sexual history. Also, diagnosis of or treatment for hepatitis, tuberculosis, or sexually transmitted infections can increase risk for HIV. And then having a sexual partner who has a history of high risk behaviors like having high risk partners, sex work, or injection drug use. I just want to pause and see if there's any questions at all on risk factors or any comments that people might have about that before we move on. Okay. So I think it's important to clear up, there's a lot of myths and kind of stigma around HIV. So just to reiterate, HIV is transmitted by blood. So sharing needles during intravenous drug use. Blood can also be an infectious material during sexual encounters if people have open wounds or things like that. And then it's also transmitted by semen or pre-ejaculate fluid during unprotected anal and vaginal, and less commonly oral sex. And then it can be transmitted in vaginal fluid. That's typically transmission during childbirth to a child. And then also in breast milk. So a breastfeeding parent can transmit to their child via breast milk. Some things that HIV is not transmitted by are things like hugging and kissing, sharing food or drink, saliva, sweat, or tears, sharing toilet seats, or generally sharing a home or bedding. It's not transmitted by insects or pets. Sometimes people worry about like mosquitoes being able to transmit it. And it's not transmitted through the air or through the water. So you can't get it by somebody with HIV coughing on you or, swimming together or different things like that. One of the questions people often ask when they are diagnosed with HIV is, can I still hug my kids? Can I still share physical affection with my friends and people I love? And the answer to that is absolutely yes. These are not dangerous behaviors. They're not high risk behaviors. And there's been a lot of work, I think, done over the last decades to decrease that stigma and just increase the understanding that, people with HIV are not, just like walking around contagious and able to infect people, randomly. So, how can we prevent the transmission of HIV? There's a lot of ways. So, a really big one is condom use. So, making sure that you're using condoms for anal, vaginal, and oral sex, or other barrier methods. Getting tested regularly so that people know what their status is. Being aware of the sexual history of your sexual partners. We really encourage folks, whenever possible, to, before you engage in sexual activity with a new partner, have a conversation. Just talk a little bit about sexual history, about recent testing. A lot of people these days will go and get tested together, just as a kind of a show of trust in each other, that we want to make sure we're keeping each other safe and that we're kind of aware of our status. If you are injecting drugs, making sure you're using sterile equipment and not reusing or sharing equipment. And then we'll talk a little bit more about PEP or PrEP for high-risk individuals. So PrEP or PEP, is there a question?
Yep. Claudia, did you have a question at TAU?
I have a question with the, I seen something on Facebook where it had people sticking like, dirty needles with blood on it in the toilet paper. So how effective would that be? Like, I don't know, that's weird. Like in a whole big old toilet paper? And how effective would that be? Like if you were to wipe?
Sure. Very valid question. So I have seen those go around as well. And I think posts like that tend to be kind of like fear mongering and not something that we really see widespread out in communities. I've locally never heard of anything like that happening. That being said, let's say that is happening, and maybe it did happen somewhere. If somebody was sticking a syringe that had a little bit of blood on it into some toilet paper, I would say it's not impossible that could transmit HIV, but it's highly unlikely because that amount of blood would be so small. And once HIV leaves the body, it dies really quickly. So unless it was really fresh blood and a lot of it and was exposed to an open wound, the risk of transmission would still be very low.
Oh, good.
Does that help?
Yeah.
Okay. All right, so let's talk a little bit about PrEP and PEP. This is a newer medication or class of medications that is available. You might have seen commercials for this. They tend to play these commercials late at night. But PrEP stands for pre-exposure prophylaxis. So this is medication that people can take before being exposed to HIV. And it's for people who might be at high risk for HIV. It's highly effective. It's available both in oral and an injectable route. So it's available as a daily pill or a longer acting injection. And this is something for folks that just maybe know that they're engaging in higher risk behavior. They might know that their partner has HIV and they just are taking every measure to protect themselves. So this is a really great option for people who are higher risk for contracting HIV. PEP is post-exposure prophylaxis. So after someone has been exposed or suspects they may have been exposed, this is a medication that can be taken to prevent that from developing into HIV. So it's taken after a potential or known HIV exposure. It has to be started within 72 hours of the potential exposure, and it's typically about a month of treatment. So this is something that is often offered for people seeking healthcare after a sexual assault, or if they find out that a partner is HIV positive after having sexual contact. Doxy-PEP is just one of the forms of PEP or post-exposure prophylaxis. It's doxycycline. It's an antibiotic that is taken to prevent STI immediately or as soon as possible after known potential or exposure. So some signs and symptoms of HIV. First, I want to lead with often there are not any signs or symptoms, or they can easily get missed. So regular testing is really key. But some signs and symptoms that can show up with HIV are things like fatigue, swollen lymph nodes, sore throat, diarrhea, chills, rash, fever, muscle and joint pain, ulcers or sores in the mouth or genitals, and night sweats. Now, oftentimes people experience these symptoms in all kinds of other cases as well, right? So this often looks like, oh, I think I have the flu, or I'm getting a little cold or something like that. So it's really easy to miss these kinds of symptoms or write them off. On the other hand, we also have people who just have a cold and get really panicked that they might have HIV. So if you're having symptoms like these and you're concerned about it, definitely, seek healthcare, kind of think through. We can help talk through, like at our Vivint Health Centers, we can talk through risk. Has there been any potential exposures that you're concerned about and that sort of thing to kind of set your mind at ease. I wanted to call out, these are so awesome. These public health vending machines that the Ho-Chunk Nation offers are really cool. I went looking to find out some more information about these. You can get home tests through these vending machines. They're accessible 24 hours. They're available in Black River Falls, Baraboo, and Nakusa. And they have all kinds of awesome public health items. So, while we're here talking specifically about HIV and AIDS today, I'm among the public health nerds who gets really excited about tools like this being really easily accessible for communities. So they offer drug disposal bags, Narcan, gun locks, safer sex kits, test strips for testing drug supplies, pregnancy tests, overdose prevention tools, and then a variety of different testing kits: hepatitis C, HIV, syphilis, chlamydia, and gonorrhea, and hygiene kits. So this is a really cool option. And I'll pause in case, I don't know if Brunel or Jamie, if you want to say anything more about these, the public health vending machines. I would welcome you to tell us more.
The only thing I would add is sometimes we do change what's in there. These are a list of the current things that are in our machines, but seasonal things do come. When summer is here, there will be tick kits, stuff like that.
Awesome. All right. So U equals U. This has been a term that's been out there that some people are like, what the heck does this mean? What U equals U stands for is undetectable equals untransmittable. So when HIV medications are taken as prescribed consistently over time, the medicine actually can lower the viral load in someone's body to undetectable levels. Meaning, if you are HIV positive, you have been taking your treatment and you have lowered your viral load to that level, you will come up negative on an HIV test, like the testing that we do in our office. It does not mean that you no longer have HIV, but it does mean that you can't transmit it. So this has been a huge advancement just in the care and quality of life for people living with HIV, in that peace of mind knowing that they can't transmit the virus. It does require continued medication adherence. If a person were to stop taking their medication, then their viral load would resume increasing and would become transmittable again. So it requires continued medication adherence, lab monitoring, and prevention strategies. So you would want to continue to use those prevention strategies like safer sex, safer injection practices, and that kind of thing. But this is a really kind of incredible advancement in the care and treatment of HIV. For folks living with HIV, I just want to talk a little bit about some of the different programs that support folks and kind of where we're at currently with treatment and things like that. So the Ryan White program is a program of federal and state funding that's aimed at medical and supportive HIV care services. And it helps cover medical, dental, case management, life care, and early intervention services. Different AIDS serving organizations in Wisconsin are funded by the Ryan White program to offer these programs. It's part of the reason why we're able to offer so many services for free at Vivint Health. And the Federal Ryan White Act was named in honor of Ryan White, who was a teenager who died of HIV/AIDS after receiving infected blood through a blood transfusion. And it was if you were around during that time, I'm older, so I remember this happening when I was young because Brian White was about my age. It was a big news story, and it really kind of helped to reduce the stigma around HIV and AIDS, just to kind of say this really can happen to anyone, and kind of reduce some of that stigma. We also have, through the Wisconsin Department of Health Services, a program called HDAP. That stands for HIV Drug Assistance Program. This is a program that ensures that people living with HIV have access to the medications that are crucial to treatment and offers medication assistance with certain HIV medications. It also offers limited insurance coverage cost assistance. So for example, it can help pay for insurance premiums. There are some eligibility requirements that apply, and it's intended to support retention in HIV care. So making sure that folks can stay on their treatment plans, continue to receive care throughout the lifespan. And for folks living with HIV, our case managers at Vivant Health can help people with accessing these programs, filling out the applications and things like that. Treatment. So HIV treatment, which is also known as antiretroviral therapy, or ART or ART, begins with choosing an HIV regimen. So this is done in conjunction with a healthcare provider. Medical professionals start you on an HIV regimen as soon as possible after diagnosis to start to get your viral load and CD4 count under control and moving towards that undetectable, untransmissible status. There are more than 30 HIV medications approved by the FDA. They're grouped into 7 drug classes that help fight HIV. So this is individualized care that would be determined by a healthcare provider. So it might look different for different people. Some of the advancements, it used to be when medications like this were first coming out, people would have to take like a handful of pills. It was so many pills to kind of target all of the different aspects of the virus. And now they're able to combine some of those drug classes so that people are not having to take huge amounts of pills every day, which just really helps people stay on track with it. You know, it's hard to take 15 pills every day for the rest of your life. That's like really, you know, an overwhelming prospect. But when we can reduce that to a more manageable regimen, it helps people keep up with that care so that they can continue to live healthy, long lives. Some specifics as we talk about HIV in Indian country. One of the things that I found was this, it's called the Indigenous HIV/AIDS Syndemic Strategy, which is a really beautiful it's like a 74-page document. And I encourage any of you that are involved with public health to check this out if you haven't already. It really looks at how to center Indigenous communities, Indigenous values in addressing the spread of HIV and AIDS. So I wanted to share their vision statement, which was, we envision a world in which all Indigenous people are healthy in mind, body, and spirit. The spread of HIV, STIs, and viral hepatitis is prevented. Every person knows their status and lives free from stigma and discrimination. And every person has access to high quality, holistic care that reflects Indigenous values, promoting relationships with each other, the land, and all beings. This vision includes all Indigenous people, regardless of age, sex, gender identity, sexual orientation, religion, disability, geographic location, socioeconomic circumstance, or health status. So it's just a really beautiful vision that guides the strategy towards addressing HIV and AIDS in Indigenous communities. I didn't want to hit you with too many statistics or numbers because I know personally I don't learn that way, but it can be helpful to kind of put some things into context. So I want to look at the graphs on this slide first. So this just breaks down the route of transmission, or how people are contracting HIV in Indigenous populations. So for men, first about 72%, that's from male to male sexual contact, with then kind of an even spread towards the other 3 transmission routes, which include a combination of male to male sexual contact and injection drug use, This graph describes it as heterosexual contact, but basically men having sex with women, and then injection drug use. And then for women in Indigenous communities living with HIV, it's about 54% through what's described here as heterosexual contact. I personally don't love that framing because I think sexuality is more nuanced than that. And it's not necessarily accurate to say that that's heterosexual contact, but typically contact between women and men. And then injection drug use is 46%, which is really high. So I think I highlight that to say that that is one area where organizations like mine and other organizations that work with people who are injection drug users can really be focusing our outreach, because that number doesn't need to be that high. We have really strong ways of preventing HIV transmission in injection drug users. And so that's something we can really, I think, bring that number down. But really, I think the important story in Indigenous communities when it comes to HIV are some of these things, like the fact that screening rates are consistently rising. So the number of folks in Indigenous communities getting screened, getting tested continues to go up, which is good. The new diagnoses in the Indian Health Service areas with the highest HIV burden are consistently dropping. So those infection rates are consistently going down. The largest HIV programs in AHS have achieved 90% viral suppression. So that's that U equals U, that undetectable, untransmissible status. So that is a strong number that will hopefully continue to rise. American Indians and Alaska Natives ranked 5th in the rate of new HIV diagnosis compared with other racial and ethnic groups. So the only ones with lower rates were whites and Asian ethnic groups. The numbers of American Indian and Alaska Native diagnosed with HIV receiving care, being retained in care, and achieving viral suppression are in line with the national average. That's strong. They do find that there is lower levels of knowledge of HIV status among Indigenous communities. So that's just people who don't know their HIV status. And as we continue to see these other really strong progress happening, that will continue to improve as well. So I found this to be really promising, that a lot of progress is being made. People are learning more, better outreach is being done with testing. There's better outreach in terms of treatment and care. So all really, I think, tells a strong story just about strength and resilience and care for one another in Indigenous communities. These are some of the resources that I found that are led by and centering Indigenous communities. So Indian Health Service, the National Indian Health Board, National Native American AIDS Prevention Center, and as I mentioned previously, the Indigenous Syndemic Strategy. So really great resources, people doing really incredible work to care for community. So I'll move now into talking a little bit more about the services that we offer at our Vivant Health locations. We have 10 locations across the state of Wisconsin. So we offer, all of our locations offer testing for HIV, hepatitis C, and then depending on the location, some of our locations also offer various STI testing. In La Crosse, we do offer testing for syphilis. Some of our locations additionally offer testing for chlamydia and gonorrhea. Our testing at Vivant Health is always free and confidential. So it doesn't matter if you have insurance, it doesn't matter your income level. We don't even ask about those things. Anybody can come in and be tested for free. The testing is really fast. So it's just a finger poke, pretty easy and basic. And we get those initial results within minutes. The HIV testing that we use for initial screening, it literally takes 1 minute to receive results. Some of the other tests can take a little bit longer. So hepatitis C test results take about 20 minutes. Syphilis testing results take about 10 minutes, but all of those take place within the time span of that testing appointment. So you don't have to wait, for a lab to get back to you or something like that. We do that all right within that testing appointment. During those testing appointments, we also offer risk reduction counseling. So we'll talk about, how is your risk for HIV? What is your sexual history? What is your drug use history? Are there tools that we can offer to help reduce the risk associated with any activities you might be engaging in? We can also do referrals for PrEP navigation. So for higher risk individuals who are interested in pursuing PrEP, which is again that pre-exposure prophylaxis. Sorry, my phone is ringing here. Sorry about that. We can refer to one of our PrEP navigators. So we have folks who their whole job is to help people access PrEP, to educate about PrEP and help people access that. We can also do referrals to case management. So I'll talk a little bit more about case management shortly here. And then also referrals to treatment. So if folks do test positive and need to be referred for treatment, we can take care of that. So we also offer our LifePoint program. Part of our prevention services include our LifePoint syringe service program. I don't know if you are all hearing my phone ringing, but we got a new phone system yesterday and we're still working out the kinks for it. So I apologize if that is disruptive, and I'm gonna see if I can make it stop. Bear with me just 1 second.
I can't hear it, Joella.
Okay, good. I'm glad it's only distracting me, but I think I just got it so that it shouldn't happen anymore. So sorry about that. So LifePoint is our syringe service program. So LifePoint offers free syringe service access services for community members who use drugs. We provide sterile syringes and other injection equipment, safer snorting and smoking supplies, safer sex supplies, so condoms, dental dams, internal condoms, and things like that. We provide safe disposal of used injection equipment. We do harm reduction planning and education with folks so we can ensure that they have the information they need to be as safe as possible. Overdose prevention education and overdose response education. So anyone in the community, you don't have to be a drug user to come in and learn about what to do if you think somebody might be overdosing. We distribute Narcan and naloxone, which is a medication that reverses opioid overdoses. And then fentanyl and xylazine test kits, so folks can test their supply so they're aware of what's in it. And then we also offer referrals to different community resources. So if folks are interested in treatment resources, housing resources, food resources, things like that, we offer referrals and help folks connect with those services. We do also have a depot. So it's like an online store through our website. So folks who are spread out, in parts of the state where we maybe don't have a Vivint Health location can still access many of our supplies for free and have them shipped right to your home. So the link is on there, or the website's on there, depot.vivanthealth.org. Or if you just go to vivanthealth.org, you can find the link to the depot there. And it's really simple and quick to place an order for things like condoms, lube, HIV home tests, naloxone and Narcan. The LifePoint Safer Use Kits are only available to Milwaukee and Wood County residents. We do hope to expand that, but there's a lot of different supplies that are available that you can just order online for free to be sent right to you if it's hard for you to get to a Vivint Health location. We also offer medical and pharmacy services at some of our locations. So our health centers are located in Milwaukee, Madison, Green Bay, and Kenosha. And those offer primary care and HIV specialty care for people living with HIV. They also offer PrEP and PEP, those medications that we learned about earlier, and STI treatment regardless of HIV status. So for folks who might test positive for other STIs, can receive treatment through Vivint Health Centers regardless of HIV status. And this care is provided regardless of income or insurance status. We also have pharmacy services. that do serve statewide, either in person at our pharmacy locations or by mail order. So folks around the state who need to access HIV medications can use our mail order pharmacy for those services. Case management. So I've referenced our wonderful case managers quite a few times, and they are really incredible people. We have dedicated case managers that connect people living with HIV to services and resources, providing support throughout the journey. If you are tested at a Vivint Health location for HIV and you test positive, you're going to be immediately connected with a case manager who's going to help you, step by step through kind of what comes next, what planning needs to be done, what resources need to be accessed. So it's really somebody to just walk alongside you throughout that journey. So they can help with things like healthcare insurance or healthcare or insurance enrollment. So if people don't have healthcare coverage, they can help access different programs, help fill out those applications, help gather the paperwork you need, that kind of thing, which is always really overwhelming. They can help folks access legal services if needed. If there's any sort of, discrimination happening in a workplace or housing or something like that, they can connect with legal services. They can connect with housing programs, rental assistance, and then also help folks access our food pantries. So our Vivint Health locations do all have food pantries that serve folks living with HIV. They are a client choice model, which means it's kind of set up kind of like a grocery store, although usually a much smaller scale than a grocery store, but where people are, free to choose what they like to eat. And food and nutrition is really an important holistic part of HIV care. It helps strengthen, having nutritious food helps strengthen the immune system, and just generally, people having food security supports treatment and overall health. Final service that I will highlight through Vivint Health is our mental health services. So again, for people who are living with HIV, we offer psychiatry, psychotherapy, and AODA services. These are offered virtually or in person. So not all of our locations have in-person providers of these services, but we have options for virtual or telehealth access to these services. And these are also available in either individual or group settings. And again, like all of our services are offered regardless of income or insurance coverage. And it's another one of our services that our case managers can help folks connect with. So that is what I brought for information. And we have plenty of time if there's questions or discussion to be had. I welcome that.
There's nothing in the chat right now, but thank you for that. That was amazing.
Yeah. I'll give people a minute if they have questions or even just conversation. Maybe folks can share something that they learned today or something that they thought was true, but now realize is not. I think that's like the myth busting, I think, is a big part of it, because we've come a long way since the 80s. For those of you who remember the 80s, I see some awfully young looking faces too. So I think it's wonderful that if there's folks who are like, wow, what was going on in the 80s? Because it was not where we are today in terms of just both, I think, compassion and empathy for people living with HIV, as well as just our understanding of how people, contract it and the treatments that are available.
Go ahead, Wittenberg. What do you have?
I learned about the toilet paper thing, and then I didn't know that after it leaves the body that it's airborne, and I did not know that you can catch it, the kids can catch it through breastfeeding. So if somebody were to take, have your kid and you weren't able to like use your own milk, then if they had it, they could give it to your baby. Like, that's crazy.
Well, yeah, and so I think part of that that's important too is that many, I'm not sure if it's been a while since I had my own babies, but I believe most pregnant people are tested for HIV, and so that they have that awareness. And then, part of that too is if you are on those medications where it can be, you can lower that viral load to be untransmittable, but it just allows people more. Um, more information and knowledge to make those decisions. So that is an important piece of it. And I'm really glad that that was brought up about the thing with the toilet paper, because I remember seeing that going around on Facebook a few months ago, and stuff like that gets out and spreads like wildfire and gets people really panicked about like, gosh, now I'm afraid to use a gas station bathroom, or something like that. And there's really doesn't need to be that kind of fear around that for sure.
So Macy puts in the chat, can HIV and AIDS be spread through dry blood also?
That is a good question. I don't know off the top of my head like the exact amount of time it takes the virus to die, but I am going to do what nobody should ever do and go to Dr. Google and just see if I can find a good answer for that. My instinct says that it is, yeah, it's very unlikely. The HIV concentration within blood after it leaves the body drops by 90 to 99% within hours. And that would be like blood that is still, this sounds weird to say, wet, like wet blood, as opposed to dried blood. So again, probably not, I never want to say anything is like impossible, but very, very low likelihood of that. Good question.
And you'd have to be getting that dry blood in
into your own bloodstream,
in your
yeah.
mouth, in your eyes.
I see Nadine's question. I do not have those statistics. I don't know, Renell, if that's a statistic that's available to you or not. I don't know if it gets broken down quite that far just because of the confidentiality around.
Yeah, and I don't know the answer either as to how many or if any tribal members are currently infected with HIV. Based on other data for other diseases, even trying to find Native American specific health data is very difficult because it's such a small group. They aggregate it into other racial identities. Unfortunately, it's a struggle to find tribe specific data. So sorry, I don't have an answer for that.
The one statistic that I can find, and this is for, it's not specific to Ho-Chunk, but for Alaska or American Indian and Alaskan Natives, ranked 5th in estimated rates of HIV diagnoses in 2022 with a rate of 10.6 per 100,000 population, as compared with whites at 5.3 per 100,000 population. So I don't know if that helps, but it is unfortunately difficult to break down those statistics, and they tend to be broken down by like those larger racial categories, and often can be misidentified too. So it's an area where we definitely have room for improvement in how we kind of drill down those statistics.
Claudia, do you guys got something again?
I was just wondering, just because I get a lot of tattoo work done, and like them sterilizing it, would that be like, could I still catch it from that even if they do put in the sterilizer thing?
So I also have a lot of tattoo work. So the answer to that is that if you are going to a reputable tattoo shop who is, doing their health inspections and things like that, that is extremely low risk. They use typically either new or sterilized equipment for every tattoo. Where you can get into a higher risk situation is like when I was younger and making less wise decisions than I do now. I was getting tattoos in people's kitchens, and that was not a good idea. So as long as you're going to a reputable tattoo shop, that should be perfectly safe.
Thank you.
I see Kalina, if I'm pronouncing that correctly, said that the tracking and statistics have to be super hard to track just based on the assumption that people who engage in these riskier behaviors aren't super engaged with medical care. That is an excellent point. It is part of why organizations like Vivant Health and other like public health, particularly Indigenous specific public health options, it's so imperative that we're doing intentional outreach and being an easy point of contact for people to learn this information. Because people aren't super engaged with medical care, people who are maybe injection drug users or engaging in sex work and things like that often face a lot of stigma in healthcare settings. So there's a lot of barriers that people have to accessing that healthcare. And so we have a growing number of lower barrier options where people can, people who come in to use our syringe service program. We always ask folks, do you know your HIV status? Are you interested in getting tested if you don't? So everything that we can do, programs like this that help educate folks so that they understand the risk factors is huge in kind of addressing that gap in service.
I did put a link to the HIV in Wisconsin report. It's older, it's from 2023. On page 7, there is a little bit about HIV in Native populations. And it basically is saying the same thing because there is such a small number of Native Americans who are diagnosed with HIV every year. It's hard to collect that data.
2023 is actually newer. Most of what I found was still from 2022. And I think that is also part of the challenge is that these larger reporting structures, it can take years for the data to come out. And so often the most current data that we have is a couple years old. So it makes it harder to kind of keep up with what's happening in real time.
Does anyone else have any questions for Joella?
All right, I'll take that as a no, and I'll do the finishing closing. So, Pinagigi, just thank you and ho chunk to Joella and everyone for joining us today. As a reminder, this session is being recorded and will be available on the Department of Health website and Facebook page. We look forward to seeing you at our next session next week. Wednesday, March 25th, we will have Chelsea from the VA in Toma, who will talk about suicide prevention with our elders, or veterans. You can use the same link as today to join all future sessions. You can add the recurring WebEx link to your calendar by emailing Vanell and I, and she will put our emails in the chat for you. As well as we want to hear from you. We ask that you please take a few minutes to complete our feedback surveys, and we will put that link in the chat as well too. You can also reach out to Vanell and I with any feedback and any further information. We thank you very much, Joella, for joining us today, and everyone else.
Thank you so much for having me. I'll put my email in the chat as well if folks have questions or want to follow up or learn more about accessing any of those services. And just thank you so much for your time and for inviting me today.
Happy Wednesday, everyone.